Recorded. Well, welcome everyone. We are thrilled you're here. Um, my name is Laura Schmaltz, and I am counselor ed faculty. I'm also a EMDR therapist at a drug and alcohol center, and I am being joined by some absolutely fantastic students. If you could each um, just introduce yourselves. Nicole, you want to go first?
Hi, I'm Nicole Schumacher. I'm a first year student in the Masters of Counseling Psychology program at Northwestern. Dr. Schmaltz was my trauma professor, and it was my favorite class that I've taken. So it was an honor to be able to assist her with this presentation, and I'm really excited to be here today. I think it's a really important topic.
Thanks, Nicole. How about you, Sarah?
My name is Sierra Smith. I graduated from Northwestern's clinical mental health counseling program this past June. I'm currently a clinician at an inpatient psychiatric hospital near Chicago. I'm also very excited about this presentation. I think it's really important that we get this information out there. And I would agree with Nicole that trauma was my favorite class. So thank you.
Great. Well, it was easy to want to work with these two because of their passion is obvious. And I think is it your first national presentation, both of you? Okay, great. Very exciting things. Okay, so AADA person, did you need us for anything? Okay, just keep rolling. Okay. I guess other than my students, raise your hand if you've ever in a course or at a conference seen the topic of abortion come up. Okay. Usually people say no, and I find that to be so curious that it's really not covered maybe in school or in presentations or things like that. So let me just bring up our PowerPoint here. When I'm in this mode, I really can't see the chat box. So if there's anything you want to comment on or ask, we would love this to be as interactive as possible. Excuse me. So just get on that microphone and jump right in. So we named this Beyond the Political for some strong and probably obvious reasons. It's hard to think of a more polarizing topic maybe in American society than abortion. And possibly what happens is there are women who struggle, and that doesn't make it pro-life or pro-choice. It just is. And so we are throughout this presentation, we have collected stories of various individuals, and obviously details have changed. Identifying information will not be there, but we have a deep gratitude for those who have been so generous with their stories and experiences. This is an apolitical zone, so kindly, before you ask a question or make a comment, just do a quick check and think about if it could be harmful to someone or if it could be politically motivated. Now, I know I'm talking to a room of counselors, so I know you all will do just fine with that, but I'll be honest, the first time I did this presentation live in front of an audience, I had an armed guard in the room. I sure did, because I just didn't know what to expect. We know that abortion impacts so many lives. So if this brings up anything for you, obviously do whatever it takes to take care of yourself. Okay. Anybody see this story in the news this week? We all saw a lot about Simone Biles and her courageous choice to honor her mental health. The story was about women who were Olympic contenders who became pregnant along the way, and talking about pressure that they sometimes felt to have an abortion. And in fact, two of the women were getting ready for Tokyo when it was last year and became pregnant and aborted. And then the Olympics were canceled because of COVID. And so they talk about really how difficult that was. One of the women, I guess when you're an Olympic athlete, the doping people come and knock at your door randomly to check, obviously check blood, check urine to see if there's anything in there. And this one track contestant was so traumatized. She had had an abortion the day before and she just couldn't answer the door. So she missed the doping people, which made her look like a, you know, that put her on the list of people they were concerned about. Okay, we all know what abortion is, right? The emphasis for this presentation is removing a fetus or an embryo before it can survive outside of the womb. Okay, in the United States, and most of my graphics and such are from either the CDC or the Guttmacher Institute, and I'll give you those resources at the end. Half of all conceptions are unplanned. Half. And so for some families, an unintended or unexpected pregnancy is just it's just adding another seat to the dinner table. It's a happy event. But for many people, you know, it's a surprise that brings with it a lot of stress, right? And we know when we're under stress, our cortisol levels increase, and that can have a really damaging effect on developing fetal brain. So that's something maybe to keep in mind when we talk about early intervention, maybe starting as early as conception for unplanned pregnancies when the woman plans to keep the pregnancy. So what percentage of all conceptions in the United States goes on to be terminated? Anybody want to guess? 25%. So half are unplanned, and of that half are aborted. So 1 in 4 pregnancies in the United States. Talking about lifespan, take a look at these numbers again from the Guttmacher Institute. All women, if we look at all women across America, about 36% will have had an abortion at some point in their life. And you can see by age grouping how frequent, how common abortion is per age. All right, this is a graph with a lot to think about. This is from the CDC, and it's looking at the percentage of pregnancies aborted in the United States by county. Okay, so we see in that that dark red, more than half of all pregnancies are aborted. So in just looking at this map, are there any things that stand out to you that seem curious or interesting? One thing I notice is down in sort of that corner in Southwest Texas, there's that dark red. And I find myself wondering if there are individuals maybe crossing over, maybe from Mexico, where I don't think abortion is allowed, maybe crossing over to obtain an abortion. I don't know, that's just my guess. Okay, so thinking about abortion for women who are under 18. This shows in the United States what kind of laws are in effect. So in some laws, the parent has to be notified. You'll see for that like lighter blue, it says consent law enjoined. That basically means the law is on the books, but it's not really enforced. Are there any questions or comments at this point? Okay, so the first story we're going to share is Jenna's. That's mine, right? Yeah, okay. Okay, so Jenna was a high school freshman and she was dating like a high school senior who was on the football team, you know, very, you know, felt very, very exciting. And she became pregnant and did not tell her parents and waited a very long time to tell her parents. She was well into her second trimester when her parents found out. And in her town, her parents were pretty prominent people. And they said, there is no way our teenage daughter is having a baby. You are having an abortion. She had no voice in the decision whatsoever. And so, and I suppose I should say trigger warning, but, you know, abortion a little later on becomes a pretty difficult thing, a hard thing on a body. And so hers was so far along that it was a 2 or a 3 day process. And the relationship ended after that. She seemed fine. She said it didn't bother her. But what was interesting, having observed her over many years, the anniversary of the abortion always impacts her, but she's not really aware. She doesn't make the connection that, so it's in a certain month of the year. She always is in a down place. She's always struggling. Anxiety, can't sleep, depressed, all of it. And it's always the month that this abortion happened. And so we know sometimes traumatic things, we might not be aware of them, but I think our mind connects the time of year, the seasons, and it knows something happened. So Jenna went off to college and became pregnant in her first semester, dropped out, got married, and went on to have 5 kids very, very quickly. So that's just a little bit about her story. Okay, so this graph looks at pregnancy rates and ethnicity in the United States, fetal loss, abortion, and live birth in the years 1990, 2000, and 2010. What we see is a decrease in we've seen a decrease, in abortion typically across ethnicities over the last, I don't know, 30 years. I wish we had data for 2020, but it does show that pretty clearly. Any questions or thoughts on that before I move on? All right, so here we're going to look at, I'm sorry, this slide, I can't get it right, but it said the reasons for unintended pregnancy. Well, 52% of the time there is no birth control used. 43% of the time birth control is used incorrectly or inconsistently. And it seems that about 5% of the time there is birth control failure. Now, sometimes there's a tendency to say to women, well, what were you thinking not using birth control or using it inconsistently? And one of my hopes in this presentation is to really kind of reframe that and take away things related to shaming and guilting and blaming, and maybe understanding what's going on when birth control isn't really used carefully. Later in this slide, in this presentation, I'll talk about some observations I've made of the relationship between childhood sexual abuse, substance abuse, and abortion. And we'll see that sometimes if there was sexual abuse or coercion in your life, there can be a real disconnect regarding your sexuality. And so, my hope is that we can find gentleness and compassion around understanding that. Here it is. So I call it the trauma trifecta. Sexual abuse, substance abuse, and abortion. And so this is just a little side presentation within my presentation. But news came out, this study was shared in September of 2019, saying that 1 in 16 women say that their first sexual experience was forced or coerced in their early teens. And I bet you that's an underreported number. There is some research that suggests that our first sexual experience sets a template for the rest of our sexual life. Now, that isn't carved in stone. Obviously, we have free will and choice. But if early on there was coercion for your first sexual encounter, you may find yourself drawn to people that are coercive when it comes to sexual activity. Whoops. So this is stuff I'm sure that most of you know regarding the tremendous scope of childhood sexual abuse. So it's saying here 1 in 5 girls and 1 in 20 boys. I have read research more recently that puts that number closer to 1 in 3 or 4 girls and 1 in 6 boys. And if you've done trauma work with men who have been sexually abused, it can be a different presentation. They can be very, mm, can be very hard to talk about. There's sometimes they're not sure. If they were sexually abused by a man, there's confusion maybe sometimes about what is my true sexual preference. Um, and we all know, right, the ACEs scale, adversive childhood experience and high risk behavior. So this is at the Guttmacher Institute. And I think this is such an important idea for us to get our heads around. Among individuals with a history of adverse childhood experiences, any of them, not just sexual abuse, risky sexual behavior can represent attempts to achieve intimate interpersonal connections. So having grown up in families unable to provide needed protection, such individuals may be unprepared to protect themselves and may underestimate the risk they take in their attempts to achieve intimacy. So that's a huge reframe, I think, in how we view risky sexual behavior. So this is just a study that looked at the high percentage of individuals in detoxification and drug and alcohol programs that report interpersonal trauma and sexual abuse. I think a number I saw is that for men who have been sexually abused as kids, the likelihood that they will at some point use IV drugs goes up by 1,700%. Okay, Lacey's story.
Hi. So this is Lacey. She's a girl in her mid-20s, recently became married. Her and her husband were starting to family plan. She intentionally became pregnant, and almost immediately after her pregnancy, their dynamic between the relationship changed, and her husband became physically and even sexually abusive towards Lacey. And luckily, she was able to realize very quickly that this was not the kind of environment that she wanted to raise a child in. However, abortion was very stigmatized where she lived. It was very conservative state, very, sparsely populated, and the nearest clinic where she could get an abortion was 5 hours away. Her husband wouldn't take her, so she had to rely on others. So she got there. She did go through with the abortion, but she opted out of the anesthesia because she felt she needed to be punished for what she was doing. So she got the abortion. A few months later, she went to the doctor's office for something unrelated, and on her paperwork, she did note that she had terminated a pregnancy a few months ago. And while the nurse was overlooking her paperwork, she confronted Lacey and questioned how could she do something like this? Why would she do this? And that triggered a lot of grief in Lacey, and grief has so many different undertones to it. There's the loss, the shame, guilt, blame. And so Lacey presented to session dealing with all of these different things, because not only did she lose, her child, she also lost her husband. That relationship started to dissipate. She lost, what she felt were values in herself. And so there was like that identity piece that was also really tugging at Lacey.
Yeah, Sierra, thank you so much. There's so many things in that story that jump out at me, and I really appreciate you bringing the element of grief into it. And it's interesting too about the anesthesia part. I want to just touch on this for a second. So when you have an abortion, you can be offered what's called this twilight anesthesia, right? And it's not as heavy duty as if like you were having open heart surgery, right? But it's supposed to make it so that you don't experience anything and you don't remember anything. One of the women that we spoke to in this project was when she arrived for her abortion, there was a person in a lab coat in the parking lot waving her down. And so she thought it was personnel from the clinic. And so she rolled her window down, and this person in the lab coat said, "A woman died in here last month getting an abortion." So this was actually a protester wearing a lab coat. And so it completely freaked her out. So she went home, missed the appointment, rescheduled 2 weeks later, went, And they said, oh, that, they explained to her, that's a protester, nothing happened, nobody died in here. But her anxiety was so high that she came to during the procedure. And I think that is maybe why, because she was so anxious. The anesthesia maybe didn't have the effect it should. And so she saw things and experienced things during the abortion that she maybe shouldn't have. And that was then a source of trauma. All right, thank you. So these are all things, to think about. I mean, the research is pretty clear that most women just report being satisfied. Most women do not have psychological ramifications from abortion, but we want to be mindful of those that do and what that can look like at different stages of life. Okay. Reasons for having an abortion. Boy, if you look at this, about over 50%, it's the timing isn't there, they're not ready, or they can't afford a baby. And then another big chunk of women, they are finished with childbearing. They have already had the kids that they planned on. And then you can see all kind of other things, health concerns, school or career, and in even some cases, of course, rape. Chantel's story.
So this is Chantel. She's in her mid-30s, and the story of her abortion takes place about 5 years ago. So Chantel was in a long-term relationship with her cisgender male partner. They both came from very Catholic families who believed that they should not be living together or engaging in sexual intercourse before marriage. However, the two weren't ready to get married. And were doing so regularly. Chantel had an IUD since her early 20s, which had been replaced according to the doctor's instructions. However, it malfunctioned, something went awry, and she found herself pregnant. At this time, Chantal did not feel like she had her finances in order. She had not paid off all of her student loans and debts. She had just started her dream job, and she was really happy to have freedom and flexibility in her life. She knew that she wanted to spend the rest of her life with her partner. They were planning on getting married in a few years, and she knew that she wanted to start a family with him, but on her own terms. She was not ready to do that right now. And she was not ready to deal with the fallout from both of their respective families. So after a lot of deliberation, Chantel decided to have an abortion. She was fortunate enough to live in a state where it was very easy to get an abortion, where people respected women's rights to choose. And so because the pregnancy was in the early stages, she was able to go through with the abortion via the abortion pill. Although she found the experience to be very physically uncomfortable, she felt really grateful that her partner was by her side every step of the way, supporting her, and that she was able to make this choice for herself. She says that she does not regret her choice at all, but she's come into therapy feeling a little conflicted because she knows she wants to start a family within the next year or two, but feels like if she gets pregnant again sooner, she would have to go through with it because she gave up her first chance. So while she has no regret and feels really good about her decision and is excited to start a family, she does feel kind of strange about going into it, knowing that she had an abortion earlier on.
Mm-hmm. Thank you so much, Nicole. So this is something we hear a lot is, that even though the decision was right for the person at the time, when they are getting close to being ready to have kids, these kind of things can surface, maybe guilt, maybe concerns that something will go wrong with the pregnancy. And then you mentioned the Catholicism. And so, that can be a source of confusion, stigma. We'll talk about that a little more in a minute. This was a study that looked at women's own words around abortion. And, I'll just pull out a few here. This woman said, "Oh my God, I'm the worst person in the world. I'm going to be so ridiculously punished in some other life for this." This person says, "I don't feel like regret it at all, because obviously if I had been with someone and lived with them, then things would have been different. I think it affects me when I obviously do want to have children in the future. I'll be absolutely devastated with the choice that I made. So again, that theme that kind of emerged quite a bit. So we can kind of think about, when we look at women across the lifespan, what kind of issues, concerns they might bring to the table. But what the study found overall was that women felt that abortion was actually the compassionate choice for the unborn child. So stigma, a lot around stigma. When there were negative mental health outcomes, it was generally, these were women who had a higher sense of stigma going into the procedure. And so these are some of those sources of stigma. What about future relationships? Do I have to tell? Will God ever forgive me? What if my family or friends found out? Will I be able to have kids in the future? Will I have to tell the future? Sorry, this computer. Will I, like our one respondent told future healthcare providers, and that was disastrous. So again, looking at stress, anxiety, and stigma, these depressive anxiety and stress symptoms are highest just before the procedure compared to any time afterwards. So this study looked at over 300 women at 3 different clinics, and they looked at socio-demographics, abortion characteristics in terms of like how far along the pregnancy was. They looked at childhood adversity. They looked at adversities that were more recent, with their intimate partner. They looked at the context of the relationship, desire for future pregnancies, perceived abortion stigma. And it was that abortion stigma that accounted for about 10% of the variance in stress, depression, anxiety. So what these researchers determined was that addressing the stigma prior to an abortion may significantly lower later symptomology. This Gomez study looked at over 1,200 adolescents and looked at the relationship of pregnancy resolution outcome and subsequent depressive symptoms. They found no association of depressive symptoms after an unwanted first pregnancy, but if the person had depression prior to the abortion, that was the most closely associated with depressive symptoms after an abortion. So an ounce of prevention is what I walked away with here, that while the research varies and most women report being satisfied with the outcome, for some women, depression, anxiety, substance abuse, and psychiatric hospitalizations can be a reality. We need resources. We need to identify and manage risks for negative mental health outcomes. One idea that we came up with was something like a resource center that provided maybe peer counseling, social support, screening for other mental health or substance abuse issues, and crisis and grief counseling if needed. Okay, this was just some data collected regarding practicing counselors and abortion. And this was really just a Facebook kind of survey. So asking, do you personally screen for abortion? The vast majority of clinicians said no. And some even in the comments said, I think if I went to see a counselor and they asked if I had ever had an abortion, I might feel that a little suspicious or wondering why they were asking that. This is looking at agencies. Again, the vast majority do not screen for abortion. So some of the comments that the counselors provided are things like, I think this topic is challenging and there should be sensitivity regarding the language, assumptions, and biases clinicians may unknowingly have. There aren't many trainings for clinicians on this topic, and there should be. I tend to ask if they have had any sexual health concerns that they'd like to address in counseling. Abortion can be stigmatizing, and many clients have said they have felt ashamed in counseling before. And one person said if this specific issue didn't cause them to seek services, it is irrelevant. Here's a clinician that said, it's important to give clients a chance to voice their history. Abortion can be a mixed bag of emotions and trauma, or not. I have had an abortion and would be greatly benefited from having some counseling about it over the course of my life. It's been 21 years now, and it's difficult for me to talk about it still. All right, so then the final thing, and we want to open the floor up to hear from other clinicians, audience members on this topic overall, but looking at responses from women later in life, um, one thing we've observed is sometimes women didn't feel regret about an abortion unless later in life they didn't go on to have any other children, and there can be a lot of what if, or this is the age that child would have been now, and how would things have been different. All right, so I'm wondering for you as an audience, what kind of things came up, what kind of questions, what kind of feedback?
Hi, it's Katie Herman Turner here.
Hi.
I'm joining from the conference, but I just really appreciate you bringing this topic up. Human sexuality is a course that I've brought to my university, this and also my last one, and start to have conversations about these things, and abortion something that I bring in a little bit, not enough, but I think in some ways it's because having a conversation about it that's not politically laden. I'm in the South right now, I'm in Tennessee. Also religious, bringing in religious beliefs and connotations, but able to speak about it in a way that's client-centered and meeting the needs of the client. So I really appreciate this and the way you've modeled the conversations, but it's just it's one of those really hard topics, and it relates to women's health and women's progressive issues and feminist ideals. And but there's so many layers that are intertwined with it that we can either personalize or depersonalize. I think it's so important. So thank you.
Wow, Katie, thank you, and kudos for bringing that into your university. I mean, it's kind of shocking that that's not a required course, and of course a lot of programs don't offer anything having to do with human sexuality, as if that's not an important part of the human existence. And I too am in the South. Yes, I understand, and I've taught for universities that are, I should be careful how I say this. When I've taught for a religious university, I wonder if it's safe and okay to bring this in and what'll happen. But every time I do this presentation, I know I'm speaking directly to people who have experienced this and have been through that. And it just saddens me that the topic of women potentially suffering gets sucked into this political vortex, right? It's one side would maybe want to emphasize that this can happen, right? And another side might want to say this is what always happens. And it's neither of those are maybe accurate representations. So thank you. Sierra.
Yeah, speaking on that part too, I know someone who, when they were, I think, 22, had their first kid, told the doctor, I don't want to have any more. Can we do something more permanent, birth control? The doctor said no, because you're young. And then this person went on to have 2 more kids. So at that, she was 28 with 3, and told the doctor, hello, like I am done now. And the doctor continued to tell her no. And she went to another doctor, and the doctor said, no, you're too young. And so there's also this part where, and then she went on to get pregnant again and had to terminate that pregnancy. And so that happened. But that's also like this other political piece, of who has control over whose body. Like that, my friend was continuously asking to have some kind of permanent birth control because for whatever reason, either wasn't using it, it was inconsistent, or whatever the case, and had to be kind of maybe forced into having this abortion because nobody else was helping. And so that medical piece too is really important when we're having this conversation.
Oh, for sure, Sierra. I had a client who was a 24-year-old man, and he knew beyond the shadow of a doubt that he never wanted to be a father. And he sought out a vasectomy over and over and over, and was consistently told, no, come see me when you're 40, Yeah, what a great point, Sierra.
just
I would
wanted
kind of
to,
like to, oh, go ahead, Chanel.
no, I just wanted to, I was just excited to see this topic there because um, I went to schools in Florida, Georgia, and North Carolina. So yes, and now I'm in Virginia. So I am in the solid South, unfortunately.
Yeah, you are.
And so the conversation never came up. And I would bring it up in I taught an undergrad class when we were doing family genograms. And because everyone will have a conversation about a miscarriage, you can talk about a miscarriage any day. And I've seen those also on intake forms. So the fact that some people can lie, which I actually know women that have said they've had a miscarriage and they didn't,
You bet.
is again only giving that space. So I'm glad that you still have, and all of you, bringing this, have that passion to bring that, because I think it's a conversation that needs to be talked about a lot more, because I think it's a hard conversation because we don't have the conversation. So the more we avoid it, the harder it still is.
Mhm.
And that's why it's such and again, it's because of misogynistic language and that oppression with women, that it's really hard, and even for trans folks, it's really hard to have this conversation. And so I just want to say, I just thank you for having this conversation. And I think again, it's political because it's this push to maintain this oppression with this type of dialogue. And so I think the more we have these conversations, which again, I always have a lot of conversations with race and ethnicity because it's always the pink elephant in the room, but having more of these types of conversations will really give that space for many folks to have. And I work with children, adolescents. And so I had a teenager once ask about confidentiality when it came to wanting an abortion. And I was a school-based counselor, and I will say I did not disclose that to a parent. Mind you, I know that I was being subjective as well, because I know that being in the South, maybe other counselors would have definitely breached that confidentiality. But to give that space to have and talk about options, and just to have that space, right? Like you're saying, client-centered, and really just giving unconditional positive regard and being empathetic. She ended up having an aunt take her because she was terrified her dad would find out and hurt her. So it's just, when you're thinking about safety as well, of like when to breach that sometimes that's not a good idea. So yeah, I've had that experience. And I think some people think, oh, don't talk to kids about that or stuff like that. But I think all ages, like you've said, it's really important to have that conversation and make sure that they know they have the access, because kids are expensive, like you said. And so sometimes people might not, but in the long run, that can also be, how you said someone was forced to do that, and many people are forced to still have kids. And I've seen a lot of unwanted children as a child and adolescent therapist. So there's so many things each way that and just thank you. Sorry, I didn't mean to take so much time. But
No, you're giving me
Just a lot.
goosebumps. I almost feel like we need to exchange information, all of us, and do a project, because I've been trying to collect people who get excited about this to work with me. And you're it. Wow, thank you for that. Yeah, just decisions, being absconded from people. I'm thinking back to the first case study about her parents forced her into an abortion that she didn't want to have. And then the other side, there was, remember when we were looking at that demographic of abortion by county in the United States, and I said, isn't that curious, that county near the border of Mexico? And there was actually a story in the news maybe a year or so ago, you might have heard this. A young girl crossed the border for an abortion and got detained so long that as every day and week went by, the pregnancy was, of course, continuing, and they held her until it became impossible for her to have an abortion. And we look at, and this isn't, trying not to be political, but we look at some of the vast sweeping changes in legislation in states. I believe in South Carolina, there are no more abortion clinics. I could be wrong on that, but I think that's what I've read.
It's interesting because Tennessee, I did some research recently, and because in my mind, it wasn't an accessibility thing, but so I think there were only maybe 3 that I found in the state, and then the cost, like the expense and the expense going up later in a pregnancy, but they were so expensive. I don't know how so many people can afford that. I don't know how much I was expecting. I thought maybe it was like a $50 copay or something, but it wasn't um, in the clinics that I found, which was really, it was just surprising.
Yeah, when I was doing some research at one point, there were in Virginia, actually, there were some providers who were doing it. I mean, I got the sense you would go to their house and do it like almost like back alley from back in the day. It was very interesting, and it was all very kind of covert and underground. Okay, well, I just want to say thank you so much. Thank you for attending this. Thank you for your awesome participation, and I hope down the road we can keep this conversation going. And enjoy the rest of your conference. Thanks, everybody.
Thank you.